Hello, Dr. Goss. I decided to do my final video on a clinic experience I had. It was a women's health issue. It was a 21-year-old female that came in primarily for STD testing, but as the interview evolved, there was other issues with her. There was a thyroid nodule that she was worried about, as well as a possible pregnancy. So I felt this experience was very valuable because I was able to do a lot of health promotion, women's health promotion, as well as teaching. Thank you.
Hello, my
Hi.
name is Maria Felix. I'm a nurse practitioner student. I'm working with the doctor today, so I'll be seeing you. Okay, so they told me here that you've had some concerns. You have a lump to your neck and a vaginal lesion for the past 5 days or week or so. So what is your concern about these things?
Yeah, I had sex with my boyfriend, and I'm kind of worried.
You're worried, okay. So was it the first time that you had sex
Yes.
with this boyfriend? Did you use protection?
No.
No protection. Okay. So you're concerned about possibly, sexually transmitted diseases. Have you talked to him about any of his history with sexually transmitted diseases?
No, I've been with him for about 3 months.
Okay, so it's kind of a new relationship. Okay, I see.
Yes.
Okay, that's okay. So no protection. Are you on any birth control right now? Any birth control pills? Any
No.
IUD? Nothing. Okay. So there is a possibility also that you may be pregnant
Yes.
as well. Okay. If you are pregnant, is it something you want to continue, or
No, I don't want
you're
it.
not really ready for
I'm not
pregnancy
ready
right
for
now? Okay. All right. So okay, let's first talk about the lumps and everything, but and then we'll go through that a little later. Okay. Okay. So as far as the lump to your neck, so when you first noticed it about a week ago, is it causing you any pain?
It bothers me like when I cough.
Okay, so you kind of and you feel it. Can you kind of point at it? It's just kind of in that area. Okay. Is it causing you to feel like you're short of breath at all, or not really?
No, just when I eat or like when I cough at night, it bothers me.
You kind of feel something there. Any pain when you touch it? Not really.
If I push hard on
Really
it.
hard,
but
really hard. You'll feel it. Okay. All right. How about any let's see, any trouble swallowing? Do you feel like it's kind of pushing too much?
Yes.
A little bit. Okay. So any history with you of any thyroid problems? For example, have they ever told you have hyperthyroidism or hypothyroidism in the past?
No.
No. Okay. So have you ever had this problem before in the past where you get this lump?
No.
No. Okay. Any recent colds, like an ear infection, any fevers, anything that might say that you have a cold or an infection going on?
No.
No. Okay. All right. So further on, I'll check and see what's going on. We might need more tests to see what's going on, to
Okay.
see if there's an infection or something. Okay. So as far as the vaginal lesion, is it just one, or is it a lot of them?
Just one. It was itchy at first, but now it's getting better.
Okay, good. Any burning in the area that you feel? Any discharge to the area?
No.
No discharge. What about vaginal discharge? You know, like when you get like a yeast infection or something like that. Have you had any discharge or itchiness to the vaginal area?
No.
No. Okay. All right. So I'm gonna be checking that. I'm also gonna be doing a pap smear as well because it's been over a year since you've had your pap smear done. Do you have any history of abnormal pap smears in the past that you know of?
No.
No abnormal pap smears. No history of like cysts on your ovaries or anything like that. Okay.
No.
All right. So I'm gonna go through just some other things from your history. Overall, do you feel like you're pretty healthy?
how's your diet? How are you eating?
I eat 3 times a day
Yeah.
and get my 8 hours of sleep.
So overall, you're pretty healthy. Okay. What about exercise? Do you get enough exercise in?
No, I don't.
No, you don't. Okay. So that's something you can work on. You always want to stay healthy, especially if you do have possibly any history of any virus infections or things like that. You wanna keep your immune system healthy. Okay.
Okay.
Okay. Any allergies to medications, to foods?
No.
No? Okay, perfect. What about, do you smoke?
No.
No. Any alcohol? Do you drink occasionally? Do you feel like you drink too much?
I drink occasionally.
Occasionally, like on the weekends with
Yeah.
your friends, things like that. Okay, perfect. Are you taking any medications right now?
An inhaler.
An inhaler. Okay, so you do have history of asthma. Okay. Have you had any flare-ups recently?
No.
No. Okay. And what's the name of the inhaler?
Symbicort.
Symbicort. Okay. We have that in your file. Perfect. Okay. So you usually get your yearly physical exams. What about your eyesight? Do you wear glasses?
Contacts.
Contacts. And have you gone to your optometrist recently? Okay. So, very good. Very good. What about work? Are you working right now?
Yes.
Okay. And do you live at home with your parents?
Yes.
Okay. And any brothers or sisters?
I have 2 sisters and 1 brother.
Okay, perfect. And there's no issues at home? Everyone gets along pretty well?
Sometimes.
To that point. Okay, perfect. I'm going to go through your family history because sometimes it's very important to know if there's certain cancers in your family that, certain things are genetic. So any family history of cancers,
My dad's mom had breast cancer.
Breast cancer, okay. So, it can create a bigger prevalence against, for you, for breast cancer. So you want to make sure that you're doing your self-breast exams every month. Usually the best time to do it is after your period, like 1 week after your period when your breasts aren't so tender. And I'll give you some information on how to perform self-breast exams. And what you're looking for mainly is like a hard lump, something that really doesn't move, just a mass, okay? You're still young, to do mammograms, and I'll also do a breast exam today when we're doing your pap smear and everything.
Okay.
Okay? All right, perfect. So when was your last menstrual period?
Last month
Okay.
around the 7th,
Around the 7th.
I think.
And do you think they're pretty regular? Is it, how many days do they usually last?
They last about 7 days.
About 7 days. Are they heavy? Do you get any cramping with your periods?
They're heavy, and I do get cramping. Like the first 2 days are heavy.
Okay, which is pretty normal, and then it kind of tapers off
Yeah.
throughout the week. Perfect. Okay. So in general, I also want to ask, have you had, in general, like any fevers? Like, do you feel like you get cold easily or hot easily?
No.
No, it's pretty okay. Any history of thyroid problems? I think we kind of went through that. You never been told that you have any hyperthyroidism, hypothyroidism. Okay. Any dizziness, chest pain?
No.
No. Okay. All right. So I'm gonna go ahead and go wash my hands and come back, and we're gonna do the assessment. Okay?
Okay.
Okay. So I'll be right back.
Okay.
Okay. So I'm just gonna assess you now. Okay? I'm
Okay.
just gonna move this over here. All right. Perfect. So I'm gonna start with the lungs and the heart. Perfect. I'm gonna go under your shirt here. So deep breath. Deep breath. And can you lean a little forward? Perfect. I am gonna raise your thing here. Okay. breath. Deep breath. Okay, you can lean back. Let me go. Deep breath. Okay, you can breathe normally now. Very good. So I don't hear any wheezing or anything, which can be a sign of the asthma, flaring up. So it sounds good. All right. So now I'm just gonna check your ears, okay? So I'm checking because I just want to check for any signs of infection that may be causing the swelling or the bump on your neck, okay?
Okay.
So, any pain when I touch? No.
Your hands are.
I know, I'm sorry. Okay. Nice and clear. So again, any pain?
No.
I don't see any redness or anything. Perfect. Very good. Alright. Now let me check your mouth. Just say ah and stick out your tongue. Very good. Alright. Now I'm just gonna check your lymph node. I'm trying to warm my hands up a little bit. So just stay seated there. So this is just to check for any swelling of your lymph nodes that we have all around here. Sometimes when we have an infection, they tend to swell up. Okay, very good. I don't feel anything here. Okay. All right, so now let's check your thyroid, okay? And your neck. Okay, go ahead and swallow for me. So I do feel a small lump on your left side here, just on your thyroid, okay? Any pain when I push down?
Yes.
A little bit of pain here, okay. So what I'm gonna do, yeah, it's not too big and it's not hard, it's almost like a little cyst, it moves around. So, I'm gonna do definitely more testing because I can't really tell right now what it is. So the best thing is maybe to do an ultrasound or something like that to make sure it is a cyst and it's not like a hard nodule, we call it.
Okay.
All right. Okay. So at this point, I'm gonna get you to undress, and we're gonna do the breast exam and the pelvic exam and the pap smear. Okay. So I'll be right back. I'll let you undress. All right. So we finished everything up. So at this point, I am gonna make a referral for you to go to get an ultrasound done. It's not invasive. They just do an ultrasound of your thyroid, and they'll let me know if the bump that you do feel there is a cyst or if it's something harder, and then we'll go from there. I know it's a little scary to have this bump here on your thyroid, but the best way to figure this out is through an ultrasound, and you may need more studies like a biopsy. But from what I can feel, it's not hard, and you don't have any history of any issues there. So we're gonna go ahead and do that. I'm also gonna get your labs, some blood work to check your thyroid, and I'm also gonna send everything for the STD testing, including HIV and hepatitis and everything like that. Okay. Also checking for infection. I'm gonna do a CBC. And then we'll do the pap smear, okay? And you will be coming back in a few days, and then we'll talk about all your results. So as far as, if it is a herpes infection, we did do a culture as well of that. It is something that you have to live with, but there's medication that we use to suppress the lesions, to suppress the flare-ups, okay? And you have to always make sure you let your partner know that you have this,
because it is easily transmittable. All right. And until we know what's really going on, I don't want you to have any, sexual activity with your partner. I want you to discuss this with him, and also, for him to get tested, because it's always good to know. Okay.
Okay.
All right. A couple other things about the birth control. I am also going to do a blood test to see if you are pregnant, and we're going to do the urine test as well. But in the future, there are a lot of birth control options. And I have a list here for you, so you can kind of look them over, and maybe we can discuss it when you come back and all your labs are in. And you can see here, I mean, there's the patch, the IUDs, and the pills. So this is kind of neat because it tells you how to use it, and the pros and the cons. Okay. And I also have an extra pamphlet here about STDs, just to what to look out for, and talking to your partner about it. Okay, so it's best just to be safe and treat it. Okay, so these are for you.
Thank you.
And I'll have you come back in a few days, and I'll just have you make an appointment. Okay? All right. Thank you.
Thank you.